We Infuse Podcast, episode number 50. Welcome to the We Infuse Podcast. My name is Amanda Brummett. In every episode, we give you a seat at the table as we talk to infusion center owners, operators, and experts so that you can get the insight you need to run a thriving practice. In this episode, we talk with Eric Cropp. If Eric's name sounds familiar, it is probably because it is. We have talked about the Emily Jerry story in previous episodes with Chuck DiTrapano and Chris Jerry. In today's episode, Eric shares his personal story with a medication error that forever changed his life, how he became a patient safety advocate, and ways we can make medication administration safer for patients and caregivers. Well, as I said, I'm here today with Eric Cropp, and many of you have heard about Eric both from Chris Jerry and from Chuck DiTrapano. And thank you so much for being here today, Eric. I would love if you would start with telling us all, how did you get into healthcare? How did you become a pharmacist in the first place?
Thank you for allowing me to be here to tell my story and get to know me better. I've always wanted to be a pharmacist since I was probably ninth grade in high school. We had a program called Explorers, and you could go and shadow a different career in the medical field. And I was able to shadow a pharmacist and see what they did in the hospital setting. And I thought, wow, that's really cool. And this was the time when we really didn't have all the computers, so you were still typing labels on typewriters, and you made a lot of things from scratch. And so it was really fascinating to me. And what really made me want to become a pharmacist is I was walking on the railroad tracks with some friends of mine, and we were just kind of throwing rocks and stuff, and I stepped on a wasp nest, and I had a bad reaction because they stung me all on my legs. So they dragged me over to the pharmacy that was in town, and the pharmacist was smart enough to go and get an EpiPen at the time and give it to me. So I would, and gave me some Benadryl, and I was able to be okay until the rescue squad came. But I just saw that was incredible that pharmacists took the action of taking care of me and helping me out, because we were a small town, so the nearest hospital was quite a ways away. So he reacted well. And what was interesting is my first year out of pharmacy school, I was able to do the same deed to another patient. By a lady was coming in from outside, and she got stung, and her whole face was blowing up, getting red and everything. And I was able to give her an EpiPen and help calm her down, and call the ambulance and everything. So I was like, wow, that is such a cool thing that I was able to repay what happened to me to another person. So that definitely made me even more want to get involved and get more into the pharmacy career. So I worked retail for quite a few years, and then I wanted to go back and get my PharmD. So I said I probably would do better if I worked in a hospital, because I had more people to talk to if I had questions, because a lot of the coursework was do it at home online. So an opportunity came about. I had done some other hospital work a couple times as a second job. So I had some experience in the hospital, but I wanted to get more. So when I got an opportunity to come and work at the university hospital, I jumped at the opportunity, and they said, well, we're really shorthanded in peds. And I thought, well, I love kids. And they said they needed somebody who knew about chemotherapy. And that was one of the things I studied as an extra residency after I got done with school. So I thought, wow, I can learn more about how to help kids. And so that made it a great learning experience. So I got a lot of training during that year. And unfortunately, on a cold day in February in Cleveland, we were always famous for having bad snowstorms and everybody getting the flu all at the same time. And it was a weekend, and I remember we had celebrated Emily's birthday on Friday because she was in-house, and her father had wanted to get her last treatment because she was actually cured from her disease. So we all attended the party. We saw her riding around on her big wheel up and down the hallways and everything. We all took turns going and get cake and wish her a happy birthday. So I knew Emily, and I always thought it was interesting that she had a boy and a girl's name, being Emily Jerry. And so her name always stuck to me. So I said, I want to see what this little girl looks like. And when we would do rounds, I got to meet her, and she just had such a wonderful personality. You just felt the energy that she didn't act like she was sick. It was she handled all the treatments so well. So on the day that this error occurred, I had got called in. I had worked 2 double shifts, the Thursday, Friday, and Saturday. So I was pretty tired, and they had asked me to come in because we were shorthanded. So right there was a red flag that I shouldn't have come in because I was really tired. And then when I saw that the whole system had been down for 10 hours, I really should have got on the phone and started calling other people to try to come in because it was just 2 pharmacists at our end of it. And the other pharmacist I was working with, he was a little bit nervous and new at this. So he wasn't handling it. Me, unfortunately, being a type A personality, I was like, I'm going to get this taken care of. And by the time we got the labels going, we had been answering phones all morning trying to get all the things that people needed. And we had not been able to print out any kind of fill list. So we didn't know what IVs needed made. We didn't have labels that print out for the IVs. We didn't have a list for the drawers where the nurse could get the meds from their med drawers. It was kind of chaotic and a mess. So when the labels all came out, we had all of the labels that should have been sent from the night, the morning, and as well as the afternoon. So we had to sort it all out, try to get some of the morning doses out, fix those up. Well, we were like the smallest part of the hospital, very small pharmacy, and things started to build up very fast. And we had probably a normal picnic table type size table that you did all the checking, and we would put everything in bins. Well, we ran out of bins and they were starting to pile everything on top of each other, which was another red flag that, I should have told everybody to stop. Let's get this stuff checked, go on to the next thing, fill up some more things to check. And another dangerous thing is I had 3 techs making IVs in one hood and 2 in another hood. So there was, again, opportunity of grabbing someone else's stuff, mixing things up, another red flag. So there's all these little factors that I was catching things that were wrong, but it was like I was feeling really overwhelmed at that time when this was occurring. And we were still playing catch up around 11:30 or so. The nurse from the floor called and said, can we make sure Emily's chemotherapy is done on the floor because we're going to send her home after her treatment. So knowing that they were going to be going off on a vacation and, we all treated the situation. It wasn't really needed right away. I didn't know if they weren't going to give the dose until 4 o'clock. The nurse was saying it needed to be done by 12. So we did everything, but we still had everything else piled up that day. And when the technician mixed up I went and pulled out the drugs and double checked everything. And she went and started making the base solution. And we had a very bad policy at the time where we made, because kids can only take a small volume of fluid at a time, we would make our own D5 normal saline. We make our own like dextrose and water sometimes. And sometimes we had to make it from bigger bags because we'd run out of the little stuff beginning a long weekend. And sometimes we didn't get restocked until Monday. So a lot of times we'd take a large 250 or even a 500 bag and put it into a smaller, either make it into a syringe with the volume needed, or we put it in a bag with volume. So that wasn't uncommon in our way of doing things, especially on a weekend. So when she made the first chemo drug for Emily, it was only for 5 cc's. So she made her own D5.5, and then we added 2 cc's of drug to the syringe. And I think when she made the next one, she thought in her brain, when she saw that it had to have normal saline in it, she thought, oh, I'll just pull it out of the vials. And she pulled out 148 mLs from 3 vials. Because it was so chaotic and she already used some of the normal saline in the first one, she threw only 1 vial in there. So I assumed that vial meant for the first bag, and then she had syringes drawn out for the 148 mLs for the other bag that she was getting. And I assumed she just took it from a bag that was sitting on the counter, because we would, again, made our own solution a lot of time. So there was a red flag. I asked if there's normal saline in it, not realizing she did not understand the difference between 0.9% and the concentrated dosage as well. So we went ahead, we added the chemo drugs to them, and then we were sent up. Well, they sat for a while, and we tried to catch up the rest of the day, getting things out. And then, unfortunately, that afternoon when they gave the second chemo, right away, there was something wrong. Emily was crying. She was saying her head hurt. She was in a lot of pain. And unfortunately, during the confusion, they kept the IV going instead of stopping it. And by the time I called the technician, because she had already gone home to ask what she had done, and when she finally explained to me that she took it out of the vials, I knew right away what was wrong. So, being I was the only one on duty, I was trying to make sure we were trying to flush out as much of the sodium out of her body. I didn't know they didn't stop the IV right away, so she had gotten a large dose. Being that she was getting all the sodium in her body, she was requesting liquids. So her family was giving her soda pop, which also had sodium in it. So we were adding to the issue. And so unfortunately, by the time we got supportive care for her, she already was drifted off into a coma. And I didn't get any communication. They really didn't want me to come to the PICU where she was in. And I really wanted to go and help in whatever way I could, but I had to get through the rest of the shift, fill all the carts and check everything and get everything done for the hospital. In the meantime, I was trying to call my supervisor and anybody else to come in because I really needed someone to take over because I was pretty devastated at the time. By the time my shift was over, I felt pretty horrible. I don't know how. I don't even remember driving home that night. The next day, I came in and they basically told me what had happened. I didn't know all the full details and basically decided that they were going to dismiss me at the time as well as technicians. She had already been dismissed first thing in the morning. I was pretty much, wow, I didn't know what to do. I was like, first they tested me for drugs and all that. They were like, why did you catch all this? And I said, did you realize what kind of day I was having that day and everything and how chaotic? And I was trying to get somebody to come in. And this is where it's really important to have some kind of group set up when you work in a hospital or even in a retail setting, somebody for that pharmacist to talk to, call up on if some error occurs, because you really need that person to move out of that area where they made the mistake and have someone step in, give the supportive care to the patient and get them out so that they can calm down, get their emotions in order, maybe sent home, so that they can feel a little bit better. Because I was just like under so much pressure that I was like a time capsule about to explode. I was feeling horrible what had happened. So when they dismissed me, they did do an investigation, and I don't know if you talked about that with Chris before, but they did say it was a system error, as well as the fact that there wasn't sufficient education for that technician. So I thought I was pretty much not, I knew I was involved in the mistake, but I was pretty much, it was understand that I tried to ask the right questions, but during the circumstances, I didn't ask enough, So after that, I didn't know what to do because I was pretty much messed. My head was not on right. And I even thought of doing harm to myself. And during my research after this happened, I found out that we, as a profession pharmacists, are one of four groups that have the highest suicide levels: doctors, pharmacists, nurses, and dentists. For some reason, I still thought that was interesting too. But we have a really high suicide rate because we've been taught and learned that you didn't talk about an error. You don't use it as a learning experience. Don't use it to teach other people. And it's something a lot of people, as I've been lecturing around, have been telling me. I had this error when I first came out of school. I've been working 30 years and it's always bothered me, and I've had no one to talk about it with. And you made me finally want to talk about it. And it was just like, it's amazing at the end of when I give a lecture, how many people open up and say, I feel a relief because I've never had nobody to tell that this happened, and how this has happened to other people I know. And, there's just not a really great support system for someone who, even a nurse, doctor, pharmacist, has made an error, what to do, and unfortunately, I got investigated by the State Board of Pharmacy. They were raring to they were trying to find any way to get me to get my license taken away. And when I appeared for the Board of Pharmacy, unfortunately, I was kind of thrown on the bus by the hospital, and they said a lot of stuff that kind of said that I was responsible, even though it was a multitude of problems. So when I came in, they were all holding pictures of Emily. And so the whole the whole session with the board, I had to sit and look at pictures of Emily, and I'm already feeling horrible enough, but they all were like shining them at me and by then I finally got a little bit of help, but it was hard because when I went to try to get any kind of counseling, they first sent me to a group that dealt with people who made mistakes or stuff because they were under the influence of alcohol or doing drugs. And they sent me to that group, and I'm like, I'm not a drug addict. I don't have these issues. I just was fortunately made a mistake or not catching something. So finally, I just finally found somebody who could counsel me, and she knew how to deal with somebody who had made an error. She dealt with other doctors and pharmacists and nurses. So it finally was given, but unfortunately they put me on so many medications that I had no emotions. So when I went to the board, I just looked like I didn't care. My way of dealing things is I twiddle my thumbs. And I remember Chris saying, you don't care. Look at you just sitting there twiddling your thumbs. You're not even upset. You're not even showing any emotion. And unfortunately, when they put you on all these meds, you don't. And I really looked very guilty, very, and by the time it was my turn to defend myself after all these different people testify, they didn't allow my people to testify. They didn't allow other pharmacists who had worked in the setting that I worked, who said it was a dangerous situation, talk. And I was pretty much, I got one person that was allowed to say anything. And then they were like, well, we're done for the day, and we're going to make a decision, and we'll get back to you. Well, within a half hour, they decided to take my license away. And unfortunately, the lawyer that I hired did not tell me I could have been able to challenge this and try to reinstate my license. So by the time I found out, it was already 6 months. I didn't challenge it anymore. So, but during that 6 months, I already had now. While I was at home, I was being harassed now because it was an article in the Plain Dealer saying that I was a killer and all this horrible things. The media was just beating me up. And then I was contacted by a district attorney that now they were going to do civil charges against me. And what they usually do when they do these cases, and I see that with the nurse who went on trial down in Tennessee, is they keep piling on all these different charges, trying to get one charge to stick. And we kept fighting. My lawyers were really good at keep challenging, and we would, unfortunately, they found an old law from the 1800s that anything that's misbranded, and the fact that the solution that was inside the bag was not what was saying that it said on the label. It was considered misbranding, and it was considered a felony. So my lawyers tried to say, well, it's so hard when you're putting a clear solution into another clear solution. We're taking faith in the technicians that they're putting the right thing in. And we take faith that they understand how to do the calculations, and they understand what the drugs are used for. And I really learned that back in that time that they didn't know really a lot. A lot of them were trained on the job. My technician, she only had a GED and was trained for 6 weeks on the job. So that's why she didn't understand. She knew the basic algebra that you needed to figure out the diluents and stuff like that to add um, to the bags and stuff. But that was her basic knowledge. And um, after what happened to me and when I was put into jail, Chris and his wife Kelly, they worked hard when they found out how little education was out there for the technicians. They worked on developing Emily's Law in Ohio, and they at the time wanted to make sure a technician had at least 2 years of education. They had to take a test to show competency. Um, they were supposed to have so many hours on the job, like as an intern, being trained in an actual IV room. The ratio of technicians to pharmacists was supposed to be no more than 3 to 1. There was a bunch of things that got watered down when we finally got passed. They basically got where all technicians in Ohio were to be certified, but there was no required education, so they still don't need to go to school. So anybody could just read the book and then take the test. They still don't need any, college education or anything like that. They just, as long as they have a GED. So I know when Chris and Kelly worked on this, it was very watered down. It was. I think they worked on the ratio. It's still like 5 to 1 for pharmacist to technician, which is really hard to see how you can see everything that they do. It was very. It started a process of waking up the country that we needed to change, especially both pharmacy and technicians. They definitely see that there was a huge ratio of technicians to one pharmacist. I mean, I was overseeing 6 technicians and 1 pharmacist. I mean, that was a very big ratio, and there was just too many opportunities to miss something. I know unfortunately, when I got put into jail, there was still nothing in place, like how to handle a pharmacist, a nurse, a doctor, what to do when they do make a mistake. And a big thing during when it happened is they really wanted to increase the amount of reporting of errors, and everybody was scared to report their errors because, okay, we just saw Mr. Cropp get sent to jail, and we are hearing other cases where, a nurse I was fortunate enough to meet a nurse and Chuck Dunham, who came to me when I was in jail, and I had not been I never really talked to anybody who had gone through what I went to. And the nurse, first name was Julie, and she had accidentally, when she went in the Pyxis machine, she was able to override, and this is still a big issue, which I want to talk about. There's still this ability to override the Pyxis machine and grab something that sounds alike, looks alike from the machine, and give it out wrong. And we see this over and over, especially in nursing, because one, they're by themselves a lot, or they're in an emergency situation, they're rushing. And nobody's doing a double check on them, when they're giving the medication. And this same thing happened to her. She ended up, the mother, she worked in labor and delivery, and she ended up giving a drug that paralyzed the mother, and she stopped breathing and she passed away. And she has to live with that the rest of her life. And it was a simple override of the machine. The medications they sounded alike, looked alike, and she grabbed it. And she had dispensed these medicines before in the past, but again, it was just one of those. You do so much in so many hours, so your eyes get tired, your mind gets tired, and she said she had worked like myself. She had worked a long day, was like a 10-hour shift, 12-hour shift. So again, we really need to be making sure that the people who are on the job are getting their breaks, getting their lunches, getting time if it gets busy, we need to be able to say, hey, we need to stop, no more orders until we play catch up, or take a little 5-minute breather so that everybody is clear again. And this is something that both when I've lectured with Chris and I've lectured on my own, I've seen hospital after hospital tell me. And the one that really stood out to me is when I went and gave a speech to the military out in San Diego. They have ability to hit a button and it just freezes everything. The nurses can't add anything into the computer. Doctors can't. It just has to be put in a hold so that it gives time for pharmacy to catch up. Because if you're just constantly bombarded with huge loads, you're just overwhelmed, and then you can't. It just becomes like an assembly line production, and you're not caring what you're doing because you're just trying so hard to get this done. So they have these opportunities where you can just stop everything, catch up, they'll make sure that if it's emergency, dose get to the patient. But most of the time, if it's something emergency, they can get it right away out of the Pyxis machine or something. So it was really not something pharmacy has to rush anyway. So I was I found one wonderful thing when I've been lecturing over and over is everybody's proud of one thing or two things or several things that they've done in their hospital that's making things change and make things safer. And I love this because I have like a huge list of, and each one of them like is so excited they brag about it. And because I'm talking to multiple groups and larger numbers, I give those ideas out to other people and say, hey, this is an inexpensive way that it's going to make it safer. They've tried this in their hospital and they've been able to reduce the number of errors from, say, 21% to 7%, So you're seeing actual results. And that made me feel really excited that we are trying to make changes, and it doesn't always have to cost millions of dollars to do this. It's slowing down, educating, sharing from department to department. I met down in Texas, this hospital called Providence. They sit down every day for about 45 minutes, and every person from every department sends 1 to 2 people, and they talk about any issues that they're involved with, and they see what other departments can do to help them, or they can help the other department. They can see if there's drug shortages and where it might be located on. So they have a whiteboard that goes around the whole room, and they're able to share from, oh, we have this difficult patient, and we know that this works. If they're sent to radiology or sent to physical therapy, this is what you should do to deal with that patient. Or, we keep having the same medication being grabbed wrong. We want to know that, let you guys all flag this, put a sign up, say, this is being grabbed wrong, or this is being mixed up wrong. So they're nipping about, instead of having this happen shift after shift, they're nipping it in the butt every day. And they've noticed their amount of errors reduced close to zero because they're talking about it. They're, they're utilizing a lot of technology, but they're also utilizing the simplest things, talking to each other, not saying it's your fault and blaming a department. They're saying, how can I help this department? And I just thought that was the most amazing thing. And I saw how it was making a difference, because I was lucky enough to talk to 3 different shifts. I talked to night shift, day shift, and evening shift. So they all were sharing me what worked at that hospital. And I was like, got to sit in a meeting, and I was just blown away. And I said, this has got to be shared with other places. They need to sit down and, try to do this, even if it's once a week, if they can't do it, but do it as often as possible. And, have these alerts. If the ED keeps having this problem of they override the Pyxis machine and they're picking the wrong med, let the ICU know, because they're using probably the same drugs, or another department, share that knowledge so that we can stop it from occurring. And so I know I've kind of gone on a long tangent, but
No, it's a good tangent.
I really, also during the time that this happened, Dennis Quaid had 2 twins were born to him, and there was a big universal statewide, even in the other countries where the wrong heparin was given to babies over and over. And it needed him to step up and not take blame to the people in the hospital, but to see how he and the people that work in the hospital could change, if it was changing the labeling, having everybody talk about it. But that was like one of the big motivators, I think, at the time. This was around when I was put into jail. Him speaking out and the Jerry's working on trying to get proper training for the technicians. And it was just amazing. Like it was like the new birth of patient safety, safety for caregivers. It started where we were talking about it, and we were trying to strip away that stigma of, oh, you made a mistake. How stupid of you. Why'd you do that? What were you thinking? And these are things you don't want to say to that person. You need to say, oh, I feel bad that that happened. Let's see what we can do to fix this so it doesn't happen to somebody else. Let's write this up and share it. And it can be educational thing that we can pass on to students. We can pass on to doctors, nurses, whoever. And that was another thing when I was doing talks. A lot of people in the different institutions were starting to do that, where they were writing up these case studies and sharing them. And people would after they read it, they go, "Oh, this occurred in this department or this person. I need to be more careful. I need to stop, think about it, watch what I'm doing, and not and be careful." And again, that was starting to make people slow down, stop getting that mentality of we're in a reduction line. We got to get everything done, get it up, and and realize these are people that could be your parents or family members, your friends. We had to make sure that these people are the most important people during your shift. They're like I always thought of everybody as could be my mom, my dad, whatever, and I really thought that was a good attitude to have. That we have to stop blame and start learning and stop hiding from the system. It's always hard to train people that are older, but you would be amazed that once you start giving them examples of this occurs, they break down those walls, those barriers to you. You're still always going to have that 1%. I've never made an error, but you down the line know we're all human. It's going to happen. They made errors when they were in school. They made an error when they were working for a 36-hour shift. It might have been something simple and it was either caught or it didn't hurt anybody, but something happened. So I think this whole movement that Chris and I and many others that in all the institutions are doing, it's the only way we can make things work in the future. We have to reduce the number of errors. When we first were talking, we researched and we found that there was over 200,000 medical errors each year, and half of them were pharmacy, half of them were in like surgery in the medical setting.
Right.
So that was scary. And when Chris does a lecture, he'll show like several planes lined up, and he'll say, "This is how many plane loads of people that die from medical error in a certain time period." And that I hadn't seen that for a while because we hadn't lectured in a while, and we did one together, and that blew me away because I'm like, wow, when you put it in a sense of all these people died on a plane, it made that 2,000 and more people, 200,000 people sound. That's a lot of people we're losing. It's a horrible situation. We got to do something to stop that.
Yeah.
So I don't have a license anymore. I'm not a pharmacist. And I said, well, what can I do with my life after I got, I had that unfortunate time in jail. What a funny story I'll tell you. When I was in jail, the first or second day I was in there, I'm like looking at faces. I'm going, oh my God, I know this person. Oh my God, I know this person. These are all the people I used to turn away for narcotics.
Oh,
And
no.
I'm going, they kept looking at me like, you look so familiar. And I'm like, oh, I just have a familiar face. But knowing that all these people I had turned away because a lot of them were in jail because they were addicted to drugs or were selling drugs. And I'm like, what an awful situation I was in. So it blew me away to, so pretty much by the time, one of the things that made my job hard when I was in jail is everybody knew my story. When I was in jail, I didn't know all the other people what they were in for, but
Right.
because I was on the front page of our Plain Dealer newspaper, they had posted it right I was in like a quad, which was like, there was 28 people in one room, and they was posted right there. So everybody knew what I'd done. So that just set me up for people thinking I had money to come after me. They thought, I could get a hold of stuff. So it made my another obstacle to deal with when I was in jail, because I'm trying to, do my time and not get in trouble and just get through this. And I was thinking of ways of what I could do when I got out of there, but
Yeah.
I'm also thinking, looking over my shoulder, is they going to come after me, do something? Because they were realizing I was that one who said no to getting their drugs and stuff.
Right.
So it was an
Right.
interesting time.
So I'm curious, what was the turning point for you? We talked about your worst day and all the then horrific stuff that followed,
mm,
and we jumped a little bit to some of the cool things you've done since then, which I want to get more into. But
yeah,
can you share, like, at what point did you decide, okay, I'm going to commit the rest of my life to being a patient safety advocate? Because some of the stuff you've done is amazing, and it
yeah,
takes a lot of fortitude to dig out of that sad place and being sad about what happened.
yeah. What made me change is when I got that opportunity to meet Julie when she came in when I was in jail. And you're not supposed to touch anybody when you're in jail. And she made the mistake. She hugged me and she whispered in my ear, "I'm there. I'm on your side." It made me realize I wasn't alone because she went through the court system. She was going to be put in jail, but they allowed her to serve her time at home and everything. I realized that when I talked to her and what she was doing, I said maybe I can do something as a patient advocate. And what also helped in that situation is the judge wanted me to do public speaking for 400 hours. And I'm like, oh my, how am I going to do this? Because I'm also on house arrest. So I had that wonderful black bracelet around my ankle. So I'm like, I have to figure out how am I going to go around on my own dime, talk to all these people, and tell my story and tell them what I want to do in the future. So, but during that time, I got over. I was like, big deal. I have this ankle bracelet. Big deal. I mean, I have to figure out a way. I had people reach out to me, which was like a blessing. A gentleman from FarmCon contacted me and said, "How would you like to do a bunch of podcasts that we could do? You get the credit for it, and then you call in and answer the questions at the end." So I didn't have to go through security through the airports when I was going to all these places trying to do. It helped lessen the burden on me because sometimes it would take me 4 hours to get through the airport just to prove that I wasn't trying to escape Ohio or whatever. So, that was an obstacle. But by the time I was done, I wanted to continue doing these talks. And I knew from these talks, I was getting more and more people reaching out to me saying, this happened to me. I made this mistake. I was getting people when I was doing talks. I'm going through the same thing you're going through. What can I do? So I was able to sit down with them and give them some direction. And I thought, wow, I feel like, yes, I'm starting to pay it forward, trying to take my bad situation and help somebody else so they don't go through the same roller coaster that I went through. So I was able to write letters. I was able to testify in court when individuals, I went for 4 different nurses and about 5 different pharmacists and went for their hearings, to the board hearings as well, and did all I could, giving them examples of why this shouldn't escalate of losing your license, because this is what this is just, when you learn to be a pharmacist, nurse, or doctor, you don't learn anything else. This is what you want to do the rest of your life. So it's really hard. If you take their license away, they're pretty much lost. And I'll go into another thing that when you do this, you take this license away, and it's really hard for us to find direction, where to go. There's nobody there to say, hey, we're going to help you find another career. We're going to help you move forward. You're going to either lead into feeling bad for yourself, wanting to hurt yourself. I unfortunately learned, if I would have known, there was a nurse out in Seattle who she ended up killing herself because she didn't know what to do with herself. She had been a nurse for 23 years, and she was an excellent ICU nurse, and she happened to make a decimal point mistake and gave too much potassium chloride to somebody, and that ended up killing the patient. And they handled it like they handled my situation. The nurse was let go. She lost her license, and like she didn't know what to do with her life. And that's part of my thing is I'm trying to convince people we have to talk. We can't hide this. We can't have people keep hurting themselves because they lost their livelihood. They lost their ability to get up in the morning. So I do talk about that with individuals. I make sure, do you have someone to talk to when I find out they've had an error? Is there do you guys have a second victim, third victim program established at your institution? And as you asked, what else? That motivated me. I worked with Nationwide Children's Hospital down in Columbus, and they started their own program where they were training individuals in each department. So if something happened, those people could step in, do the job, consult the person that made the mistake, make sure they're out of this system, out of there, make sure everything's recorded. There's self-care for the caregiver, as well as making sure the patient is okay. So I was amazed that they did this. And it was, this started with the University of Missouri, a nurse out there. Her last name is Carr. She started a program out there, and I was lucky enough to hear a lecture. I was giving a lecture, and she gave a lecture, and she was starting this program all over Missouri, and she was like trying to teach other social workers and other people who would need to step in when an error occurred, how to develop these programs in their institutions. And I just thought, this is amazing. This is going to help so much. I wish this was available when I was happening. So I have stepped in and looked at when hospitals have been starting these programs. I've helped them where I thought they might have forgotten something, or what I learned from what didn't do well when they introduced it at another hospital. They've shared what's worked and what didn't work. So I feel like I've become a good communicator between hospitals as well as between pharmacists. And it's not just in the hospital setting. I have reached out and jumped in to help the retail pharmacists, as well as doctors who are working at other offices with their nurses and stuff. And we do so much chemotherapy in the clinic setting. I have reached out to them about making sure they have programs set up too, because there's an opportunity for a mistake to happen. I unfortunately had cancer myself 5 years ago, and they do have an amazing check system to make sure they're looking at the chart. They have another nurse reading through the IV, checking it. They have a system where two pharmacists have to check the compounding together. So I'm seeing all these major changes that happened in the last 16 years that weren't going when I was involved in it during around 2006 when this happened. So it's been amazing, being on the opposite side, being the patient. I've seen what's working, and they're asking all the right questions. Are you allergic? What hand do you write? And they're asking all the right things. And when they had to treat my the cancer tumor, they made sure they wrote it down. They wrote it on my leg, what the tumor was and everything. So there was a double check even for them if they had to look to see what was needed to be treated. It's right there in ink on you. So I'm seeing it again. It's not just pharmacy. I'm seeing it in surgery. I was seeing it in the oncology setting. So things are not perfect. Unfortunately, COVID made it was so hard. I've noticed so many people, unfortunately, getting sick now because they waited so long to get treatments and everything. And that the whole our whole jump of making sure people are getting taken care of got put on hold because we're trying to protect them, but a lot of people didn't get the right treatments from eating their mental meds to getting the right tests to prevent cancer. So that's another thing I'm like talking about. How are you dealing with that? You're seeing somebody that's now stage 4, and it could have been caught if they had to come in during COVID. So again, it's another thing where I thought counseling should have been involved because the nurses were taking it personally, the physicians were taking it personally, and even some of the pharmacists, because they did rounds and they talked to those patients and they felt, wow, if we only had stepped in sooner, we could have helped them. So it's not necessarily a medical error, but it's an error in that we didn't give the care to the patient in the timely period. So yeah, that's it. I've tried to take my whole negative situation and try to be as positive as possible. I mean, you have guilt. You always will. You wish I mean, I still relive that day in dreams, and I'm always trying to fix it. But I figure if I can let people know and they think about, they need to slow down, they need to be, very accurate when it comes to doing chemo. I've gone to, I've lectured about what they should do now, and I've seen so many institutions that do oncology have, they don't do chemotherapy on the weekends anymore. Because there's not enough staffing, so they make sure there's always 2 pharmacists on duty. They make sure that the oncology is separate from the IV room, and it's like that they only use manufactured solutions. There's no making any kind of thing from scratch, even if it's taking some solution. They're only taking it from the bag, and that the 2 people are checking that to make sure it's coming from a bag. If it has to be only 3 mLs or something, but there's a big checklist, just like how now the airplane pilots go through before you fly. There's checklists now in the pharmacies when they're dealing with making chemotherapy or making any drugs for their ICU. There's a checklist. And going and lecturing, I got to learn what's been working in the hospitals, from having cameras set up so that you can see, if you're working on the floor, you can see the technician, you can replay the whole process. You can see them drawing out from the vial. You can see the vial sitting out. You can see the syringe. So you're seeing all these steps that you didn't see before because you were watching over 7 technicians and you can't be there at all at the same time. So now there's ability to go on the computer and actually watch them make everything. So you can do a double check, and people are able to care. The bar scanning, if that would have been introduced when it was supposed to at my hospital, it could have caught this there at least 10 times, from her grabbing the vials to me scanning to see what she had used, because I would have had to scan, oh, she didn't use that, she used the vials. I would have said, oh, you got to make this again, this is the wrong thing. That frustrates Chris and myself so much, because when institutions like from grocery stores to the clothing lines, they scan everything. Why can't you get this in the hospital systems? It's still like less than 20%. I think he and I looked it up, that is still, there's so many places that don't use bar scanning, and that's something that is such an easy catch. I mean, retail has really utilized that. From they take the picture, they blow up the picture so that they can see. So there's no way of looking at the label and missing something from the numbers to the strength. So that is made. I think that's a wonderful thing. The new testing of the solution now, they test the specific gravity, and they have these machines that will identify what drug is in there and what concentrations because of the specific gravity. And I think that's wonderful, because that blows, when you are taking clear to clear, you're like praying that's what they put in there, because you're not, you can't see everything what's in it, if everything's in a clear solution, there's no difference in color or anything like that. So those, and they're getting quite inexpensive. They're not as expensive as I thought they were, and some companies have come out with, they're like $5,000. But if you think of how many things they could catch not causing an error, it's amazing. So I the one thing that I worked in the past on was coming up with a system that could check your calculations. I was a pharmacist when I worked, volunteer to work at night, and you were the only pharmacist on duty, and you had no way of checking your math. And at the time, I knew several institutions were trying to come up with a system that you could go and plug your numbers in, and it'd be a fail-safe way of checking your math. A nurse could do this on if she was calculating a dose for an IV or changing an IV. It was another set of eyes, even though it wasn't a real person. It was the way, if you were doing the calculation, if it didn't come up right, you would knew, no, you did something wrong. You need to redo it, or, call somebody and have them double check you. But I think I've seen several institutions in my time working out and talking that have introduced that to, especially when you work in a small hospital and maybe only have 120 beds to 200 beds, and you don't have the staff like where you maybe have two nurses on a floor, and we're at either ends of the floor, so they can't always check the insulin. They can't, dosages against each other. So there's new programs that it'll go through their MAR, and it'll show it, and it'll show them actual pictures. This is what should be drawn up, so they have something to double check. It sounds simple, but it's a nice thing to double check on when you don't have another set of eyes. So I've seen other systems where like I said before, you can go on the computer and it'll save everything, so you're not live watching it. You can be checking it later on, but if you go, you can go, oh, we need to pull that IV because this didn't look right, we need to remake it. And you don't have to go into all the details. You just say this, you don't feel comfortable, and they can remake it, but they can catch it before it goes, when they're doing the checking of the IVs. That's the time when they can double check to see how everything was made. So all these things, I think, have made pharmacy easier and made less chances for error. I'm seeing more of staffing where they're making sure that there's two people on at all times to help each other. Even at night shift, there's somebody to call if it have to call the other. If you're like working in children's, you have an adult person to call too to double check. But there's ways so that you have communication. I think that's the biggest. Another thing is communication is free. You can just say something to everybody, and it can catch. I mean, like I was saying before, if you could just talk and say, this keeps coming up, instead of waiting until now we have 15 of the same error. If we just talk about it, maybe we can reduce it down to one time it happened, but now we'll just see we can prevent it from keep occurring shift after shift after shift. So
do you have any advice in creating that? That culture of safety, I know takes years, maybe even decades to create. But if you can create it, then, it is a space where people are comfortable brainstorming and throwing ideas around, asking for a second set of eyes without feeling like there's any egos involved, and, hopefully ultimately reporting errors. And what have you found? What is unique in the facilities that have that?
What I found is if we can reach the students when they're in their training period, I do like a lecture to the case medical students, and then I do for their nurses, and then I do for the community colleges. I talk to their nursing program. They come back and say that they are more willing to question everything before they say, I'm new, I'm learning. There was a time when you got out of school, you were kind of like shown real quickly, and then that was it. You weren't told to keep questioning if you still didn't feel comfortable. So I've seen a lot more of them coming back and giving me examples of what's occurring, and they're seeing where it could change. And so they're going back and telling the nurse who's working with them, you guys need to try this. And they've said that coming back after they've been on working with the same staff for a couple weeks on their training, that these nurses, even pharmacists, are more open to making these changes, and they talk about it. So that was one that I did see that makes a difference, is if we can reach and talk. I'm knowing more and more schools are talking about medical safety, so that the kids are learning when they're in school. So then when they go on to work in the hospital or even in a retail setting or whatever, or in the doctor's office, they're more likely going to ask, well, what do you do to make it safe for me? They're asking, and I try to encourage them when I'm telling my story. I say, hey, ask them what kind of program do they have for medical safety? Do you get trained in the job? Is there a reporting system? Is there someone, on duty that they can talk to if they feel bad about something? Or is there a way that, is there any teaching modules in case they don't feel comfortable giving a certain drug or something? I try to encourage them to ask those questions, because I think it's the education that's going to reduce those medical errors as well. So I've seen a lot of people write me letters and give me feedback, because I'll come the beginning of their semester, and then my friend who teaches the nurse has me come in at the end, and we just talk about what did they learn, and it becomes like a 2-hour session of learning all these things that they've caught, and like what they know now to be more careful about. And like they'll speak up and say, you shouldn't be working in this condition. Like, they'll be the squeaky wheel, because they're not going to lose anything, because they'll bring up to their instructor and they'll say something to the institution that this is not safe. So it's, again, more and more people speaking up makes a big difference, because like you said, it's hard to change people's minds and ideas. We've been able, a lot of times when Chris and I were lecturing, we talked to the boards, because I think you need to get involved with the boards of the hospitals, the presidents, and you'd be amazed how many presidents of a lot of the institutions are on board, because they don't want to pay out these huge dollar amounts for these stupid errors, and a lot of them are really dumb errors. And then they also just want to keep their staff and patients safe. They don't want to have a bad reputation of being, mistakes having occurred and everything. And a lot of things I've noticed too is there's a small group of people where when an error occurs, they're working on having the person who made the mistake confront the patient with somebody as a mediator, to try to stop this from escalating to this thing. I feel, have them say, if the patient wants to talk to someone and the caregiver wants to talk, they work together and have them talk and say, I feel so horrible this happened to you, and I don't want this. I'm and say, be honest. I've learned from a mistake, and I'm going to make sure that doesn't occur to somebody else. And it breaks down that the patient isn't angry. There's a lot of people that something happens to them, they're very angry. And if they're just a communication, you don't even have to say that person made the mistake. You can have somebody from that department come and talk to the patient and say, we are very sorry that this occurred, and we will do everything possible to make it right, and we do not want this to occur again to somebody else. And it's made a difference. I thought a lot of people were scared about that, because they thought, well, you're sharing so much information, they're going to want to sue more. But they found that it quieted down that thinking of, they didn't care. Well, I should just sue them. I'll get this much money for them they hurt me. And it's a little sub factor, but I think it's really making a difference too. It's just, like I said, even if it's not that person, it's a representative. And I did this when I was working on hospice, and I had a pharmacist who didn't know what they were doing, and I shouldn't have put them on night shift for doing that. And I ended up going in and making the dosage, but it was like the poor patient was they needed the medicines right away. And I went and faced the family and explained to them that I was really sorry that this occurred. And I think I made a big difference because it could have escalated to something else. But the fact that I admitted that this was wrong, and I told him what I was going to do differently, and I kind of relieved that situation, so that, because it was an error, because that person didn't feel comfortable with their doing that night, to send out a cartridge of morphine. And I didn't realize when we hired this person how they didn't know enough. And like I didn't know that my technician didn't know, this other pharmacist didn't feel comfortable. So it was this was before this happened to me, but I had learned from that to talk to people and try to appease the situation. And the family was grateful, and they wanted to hear someone just be honest with them. So it's
Yeah.
not a perfect picture, but that also helps and again, it's that communication of, people will be more likely less angry at you if you just admit something. So if it's not to the patient, it's like, hey, this happened to me. I want this not to happen to another nurse on the floor. I don't want this to happen, to another patient. So again, it's breaking down those barriers of, we don't talk about, we just push it under the rug. We have to talk about it. And
Yeah. And the
so I
data
really think
backs it up.
it makes a big difference. Yeah.
Yeah, absolutely. So I know that there's a lot written about it from a risk management
Mhm.
consideration, and that it absolutely makes sense. And I am curious, especially in your personal situation and with the beautiful relationship that you and Chris Jerry have today, was it also simply therapeutic to be able to have that conversation with
It
him?
was, because when we got to sit down for the first time together, I was able to, like, what I wanted to do that night that it occurred. I was able to say, I am so sorry this happened to Emily. I was able to, I wasn't even allowed to say anything when this escalated, and I wanted to talk to them. And I think that's what especially him at the time, he just wanted someone to say, hey, we messed up. We're sorry. And the hospital did their best of, appeasing them and, settling and everything. But I think that Jerry's really just wanted, someone to say, I'm sorry. And it wasn't really done until that day when we both sat down. And, everybody deals with grief differently. Unfortunately, Kelly was more angry at me, and she had every right to be. And that's how, and so when her and her father um, decided to make this go to civil, they didn't get what they wanted from me, and I thought I sent them a letter and everything, and it never got to them, and that made Chris sad too, because he didn't know how this had escalated, because by then his unfortunate the fact that their marriage it kind of destroyed their marriage, going through all this grief about their child. It was hard for him. And then when I think we got to sit down, he was able to say sorry to me as well as I said sorry to him. And we realized it was time to take this negative and make something positive of it. And we were lucky. He had a wonderful girlfriend at the time that really, she talked to him and was able to, like, hey, I think you really need to talk to this guy and, like, tell him how you feel, and Chris was never really angry with me, but he at least was able to express how he felt. He said, I felt so much anger in the beginning, but then I realized when I researched all this stuff that you weren't the one main person involved in this. You were the kind of scapegoat. It made me, again, that was like my second step of my healing process, because I started to find out first that there was other people like me, and that there was ways to go on with my life. And then secondly, getting the forgiveness that I felt I needed to get something to alleviate a lot of the guilt. Because when I was lecturing, I was, everybody said, you just sound like you're just miserable. You're just horrible. And I was, because I felt a lot of guilt. I mean, unfortunately, nothing happened to the technician, because they pretty much pressed her. They said if she would testify against me, then she wouldn't have to go through the same thing. Now, she still is living with it, and we tried to contact her, but I know she's living with a lot of guilt, and she's going to have to do that with the rest of her life. It's hard. I mean, we talk about that there's such a, one of my slides when I do the talk is there's like 6 steps. And at the 6th step, it's where are you going to go from here? You go through the grief and all this stuff, and you go through the learning. And if some of us get trained in consults, some of us have to forget about it and go on with it, and some of us get let go, or so there's at the end of the chart, there's usually 3 arrows. One is you move on, and and everybody learns from it, and you thrive in your job. Then there's those who kind of live with it. They're miserable. They begin to hate their job and everything. And then there's those who just fall out. They drop out of the profession and everything. And when in my situation, because none of these things were done, counseling and support and letting the person still work in the job, it affected me as a pharmacist. The technician never practiced anymore. The nurse who gave the dose, she ended up changing careers, so she wasn't even doing nursing anymore. And the doctor got out of oncology. So that right there was 4 people that were 4 professionals that could have continued to do their job and make a difference in people's lives, and they all changed. Their lives changed. So that's why it's so important to be this special person, shoulder to cry on, person who's going to step in and take care of the problems. It's so necessary. We're going to avoid those career changes, avoid suicide, avoid burnout. We're going to avoid all these things that, because the people are living with the guilt and all that, we can avoid a lot of that stuff. And again, I go over it, say this all the time, but it's education. It's use it as a learning experience, not as a punishment.
Yeah.
I don't want to see anybody else. I mean, I'm going to try to do my darndest to go down to Tennessee right now and help Rhonda with her case, because I know she felt so much guilt. She pleaded guilty, but jail's not going to solve the solution and solve her problem. She needs to do is lecture and tell her story and tell how the Pixis machines this has got to stop, because everybody shook their, said, oh, I know this happens still in my job. This happens everywhere. So why should one person be punished for all this, the same mistake that's occurring over and over and over, and use this as a learning, like we got to fix the system in the Pixis machine so that nobody can override it. It was like in my situation, when we would make the nutritional bags, they call them TPNs, if there was opportunities for the technician when they were entering the orders and to override when there was too much of a concentration added, and if the pharmacist wasn't double checking things carefully, it could be missed. And there should be no technician should be able to override a system. And I've worked at 2 institutions where there was always issues with that, and the pharmacist had to go in and fix it. But they couldn't stop. They have a stop in there to prevent some person from entering the wrong dosage or wrong amount. So that's, again, a system. We have to have better computer programs. There's just so many meds coming out. We can't keep track of everything and all the different interactions, and there's too many sound alikes, and yes. So it's just, again, we got to get better computer programs out there that are going to have red flags on there that just say can't dispense this. It's going to cause this and this issue, or you pick when you're scanning it up, you pick the wrong medication. This one can't. It's just, again, it's good, better computer programs, better ways of stopping from sending out being able to grab the wrong dosage in these Pixis machines, and even in the drawers, because a lot of the drawers are locked and they can only pull out the drawer for that patient, but by the fact that they scan the patient and then scan their thing. So there's systems there's always ways to override it, because I've seen hospitals where they have a whole page of the patient's ID on one page, and they get to scan it and grab the meds and go to the room. So it defeats the whole locking the drawer and everything. So there's always ways that humans are creative to override things and stuff. You'll find it, and people share that. And I try to say, make sure that you're not doing this. So Yeah.
Right. Instead of telling that in orientation, let's talk
Yeah.
about reporting and sharing
Yeah.
information.
Yeah. I mean, I'm praying, now we've seen what happened to Duranda. I hope that it's not going to make people then be afraid to report errors and do this report, and not let this thing escalate. I don't know why this happened and occurred and why it didn't stay in the hospital. I don't know if it was again a family member or something that wanted this to go to court. There's still it's very scary that we don't it oversteps malpractice. You think you're protected by malpractice, and that's not necessarily true anymore. And that doesn't help you when you become in a civil case. That doesn't pay for your costs of being sued. None of that stuff. That's all out of your own pocket. So that was an issue that I was like, oh wow, I now paid 75 grand to pay for lawyers to try to keep me out of jail and to fight this, and you don't have your job, so you can't even you're borrowing from this thing and that to pay that. It's scary when you're going through that. You I just hope she has somebody there that's listening and talking. I've read articles that people are trying to show their support, but they need to have bodies down there when she's being sentenced soon that can speak out before. Because when I was sentenced, they waited and they delayed mine, and that judge had a surgery procedure done, and he changed his whole mind of what he was going to sentence me by what had happened to him. So I was using it as an example, even by him, because something happened during his stay at the hospital. This was shared with you by my lawyers afterwards, but because everything was like, I was only supposed to do home arrest, and then everything changed. I didn't know I was going into jail that day. It was all of a sudden you have to serve a year of jail, a year of home arrest, and 800 hours of community service. And then he decided I'm going to cut that in half. And then I'm like, oh my God, I'm going to jail. I was like, it was a eye-awakening experience, because I'm like, I didn't know it was going to happen to me. I thought, we had talked it through that I would get a less punishment of it. And I thought the fact that I was lecturing and everything, that I would be a better penance, because I was learning from this mistake, and that I was helping others prevent having the same thing happen to them. But the court system didn't really look at it that way. Yeah.
Yeah. Yeah. Well, I'm thankful for everything you did afterwards.
Yeah.
With it, for sure.
Have I answered a lot of your things?
You have, yeah. You gave us tons of great information. I would love for you to end with one last piece of advice for infusion center owners and operators. What's something tangible that they can do tomorrow in their center?
If they can possibly make sure they have some sort of bar scanning going on, and if they can afford the opportunity to photograph when the technicians are making the solutions, I think those are two of the biggest helps, because one pharmacist can't watch everything that's being done, and we're always putting, clear into clear, and you also need to make sure you have the best working conditions, because so many of us are given a space that was just left over in a hospital or in an institution, and it's not necessarily safe enough to be really doing what you're doing. And we saw that there was a pharmacist who was prosecuted for giving out contaminated eye drops that blinded a bunch of people in the New England states and stuff. So, and now he's serving 7 years in jail right now. So you really want to make sure you have the best conditions for your workers and the safest conditions for the patients that you're taking care of, because that's a new thing too. They're going after in the setting. If you're worried about being taken to different levels, we all don't want to open our mouths when we're working in these bad conditions. Well, if you don't open your mouth, that situation could come about, and I don't know the whole story. I mean, I got 2 different stories, but I believe that they probably said something about the bad working conditions, but they didn't say enough. And you really got to say, hey, I don't want to be another Eric. I don't want to be another Julie. Or, Chris has his image of Emily put on a lot of the pediatric doses, and it reminds people to take a little extra time. And some of the hospitals have a picture of Emily. So they look at that every day, and they know they're doing this to make sure that no other Emily occurs. And I think that's the amazing thing to do is you in the back of your mind, you're going to make sure that you're going to try to do the least amount of harm to anybody, because you see her face, you know that everybody you're taking care of could be one of your family members. So I just have it, take advantage, if you can afford it, take advantage of the technology out there, because I think that's going to make things run the smoothest. Have an opportunity, if you're overwhelmed, have a stopping moment. If it means having the staff take a 5-minute break, everybody just walk away and then come back fresh. And then, make sure the conditions are great, because I still keep reading about those. And, a lot of pharmacists they're going after the pharmacists that are compounding. So these IVs are considered compounding, and they're having a lot new laws coming out that are going after these, institutions that are compounding from eye drops to IV solutions and stuff. So you want to make sure you got that checklist like the pilots have. You're doing everything on that list, and have it at every station. They look at this checklist, and before it goes out or is delivered, they've gone through that. So that's my advice.
Okay, thank you so much for that. And honestly, Eric, thank you for being willing to share your story and the tragedy that you went through, especially in the spirit of helping other healthcare workers hopefully avoid that. And thank you to you and Chris Cherry for all the work that you guys continue to do. We
thank you.
Really appreciate it.
And if you can pass along, if anybody wants to contact me, if they want to contact you, you can give them my email address or my phone number, and they can always contact you and pass it along. I'm more than willing to come and talk to them, help them, talk to their institution if they feel like they're working in bad conditions and someone needs to be the squeaky wheel, because I don't have anything to lose. So I can be their advocate and say, you can't do this. And I give them plenty of examples of where it escalates from them not doing the right thing, because I keep files of that stuff.
Okay, that is a great offer, and I hope everybody takes Eric up on it. And we so appreciate your time.
All right, thank you so much.
Eric had so many great tangible strategies for supporting healthcare providers and reducing medication errors. I hope that you can utilize them to create a safer infusion space for your patients and caregivers. And if you aren't familiar with the WeInfuse software platform or RX Toolkit, take a test drive to see how they can save you time and money in your practice while also creating a safer space for infusions. My name is Amanda Brummett, and we'll catch you in the next episode.